Now to France, which has confirmed its first case of Ebola virus linked to the outbreak in the Democratic Republic of Congo. The health ministry says the patient is a doctor who recently returned from a humanitarian mission there. The patient is said to have mild symptoms and a fever. Now, this is interior footage of the Paris hospital where this doctor is being treated in an isolation unit like this. And authorities work to try and trace contacts. In the DRC, the number of confirmed cases has now risen to more than 1,000 since the outbreak began last month. More than 270 people have died. Well, Dr. Chris Smith is a medical consultant specialising in clinical microbiology and virology at Cambridge University's teaching hospital, Addenbrooke's. He also presents the podcast The Naked Scientists. Well, welcome to DW. What's your understanding of how this doctor caught this terrible disease?
Well, we see this when people go to help. They sometimes pick up the thing they've gone to help out and combat, and they bring it home with them. We've seen this before, both with Ebola, but with other diseases, and that's what will have happened. The only source of Ebola, once it's spreading in a human population, is another human who's symptomatic. This person would have had close contact with patients who would have been infectious, and that's probably how they got it.
OK. And what sort of conditions will he be kept in Paris?
Well, most countries, most developed countries, and the UK as an example, Germany, France, they have a protocol for what are called HSIDs, or high consequence infectious diseases. Specialised units have specialist isolation facilities. You just saw pictures of one of them, where there are dedicated teams who've been highly trained in how to make sure that what goes in there doesn't come out, except as a healthy person again. So basically, it's trained staff, proper conditions, appropriate PPE, personal protective equipment, that makes sure that infectious diseases can't spread beyond the confines of that unit. And there are a number of these strategically placed around countries. And when these are diagnosed, people are moved there quickly, following appropriate protocols, and put into those isolation facilities so that effectively you stop the chain of transmission. They can't give it to anybody else. And so,
and I appreciate this is just speculation, do we presume that somehow that broke down in the field? The personal protective equipment perhaps wasn't as secure as it might be. There was somehow contact between this doctor and an infected patient.
When you're dealing with infectious diseases, these microbes, these viruses, they're fractions of a millimetre across. Just 1/10,000th of a millimetre in some cases. And there are billions of them being shed by a person who's infectious. And this means that you've got something absolutely tiny and enormously numerous with a really low infectious dose. And when you've been working really hard, and despite your best efforts, you occasionally make mistakes when you remove your personal protective equipment, when you're washing and cleansing an area, and it only takes a very small number of those virus particles, with some viruses, this one included, that you're going to get infected. And so, it is unfortunate that despite the best efforts of the majority of people, this does happen from time to time. And we saw it with the last big Ebola outbreak in West Africa.
The head of the World Health Organization has been trying to reassure everyone. We'll hear from Tedros Adhanom Ghebreyesus and then come back to you.
Whenever a case happens in Europe or other parts of the world outside Africa, I see overreaction. But I don't think overreaction is important, needed. No need for panic, because in the past 50 years, the number of cases that were detected outside Africa are less than 30. Of course, tens of thousands of cases in Africa, but less than 30 in the rest of the world in 50 years. So the risk to the rest of the world is low.
OK, but now we have a case here in Europe, Dr. Smith. I wonder how worried French and European health authorities and indeed the general public should be about this disease escaping.
Well, I echo Professor Ghebreyesus' point and also point to the fact that we had a much bigger outbreak about 10 years ago in West Africa. There were tens of thousands of cases then. We've had about 1,000 to 2,000 cases in the Democratic Republic of the Congo. And in that much larger outbreak, historically, we also did not see significant numbers of cases outside the African continent. This virus is most transmissible when a person is most symptomatic. And actually, I'm quite reassured by the fact that the French have identified this case and isolated the case, because when you know what you're dealing with, it's far safer than when you don't know what you're dealing with. So the fact that they've actually promptly identified a case and isolated that person, it's very unlikely there'll be further onward transmission. There hasn't been in the past, and these protocols really work. So actually, I'm reassured. This shows us that the system is working.
Although a significant difference here is that the Ebola strain that is currently ravaging the Democratic Republic of Congo, this Bundibugyo strain, it has no vaccine, and existing Ebola vaccines don't protect against it.
Yes, but in the West African outbreak of about 10 years ago, when that began and caused tens of thousands of cases, there were no Ebola vaccines and no drugs against Ebola then either. And it was that catalysed really galvanised, in fact, world attention and led to the creation of those vaccines, which ultimately helped to bring that to a close. Now, I get what you're saying. Under this circumstance, we know that those vaccines haven't been formally tested against Bundibugyo, which is the current cause of the outbreak, and it is a bit different to the other Ebola cases we've had in the past. That needs testing. But at the same time, we're in the same position as we were about 10 years ago, and the measures that were taken then were very effective. Public health measures are what are needed to stop these sorts of things, which means you use PPE, you isolate cases, and you give information, because many of the cases that happen on the ground in the affected countries occur because people just don't know what they're dealing with, and they don't know what the right thing to do is. We had terrible reports of people attending funerals and burying their dead, and they were being exposed to the virus because of death rituals and funeral rituals, which should never have happened if there'd been good education. So those sorts of interventions are really top of the list. And then keeping an eye on the rest of the world, where we know the risk is much lower, that actually comes second. The priority is on the ground, stopping this getting any worse right now.
Good talking to you. Thanks for joining us, Chris. Dr. Chris Smith.
My pleasure.
From Adam Brooks Hospital.